This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's Health Watch time here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. As always here on the program, which we are here every Sunday from 8 till 9, we talk about the who, what, when, where, why, and how of Innovative Medical Associates and how it can potentially help you and your family improve your overall quality of life. That's our mission statement, and we urge you to stay tuned for the program here on Talk Radio 1210 WPHT. 855-839-1210. That's the number here in the studio. If you have a question for Dr. Molly, or you want to run a medical challenge that you're having by her, that's the time. Call in anytime during the course of the show, 855-839-1210. And as always, we say good morning to Dr. Molly.
Hey, John. You sound good this morning.
Well,
you sound robust today. Come on.
Well, that's what happens when you don't get too much sleep.
Okay.
Tell us in a few words, and again, it always turns out to be more than a few words, but
yeah.
What do you do? I had a friend of mine call me this week and say, does that stuff work? I heard you do the commercial. He says, does that stuff work?
Yeah, so, John, our commercials can be the bane of everybody's existence because they really, in that period of time, you really can't ascertain what the heck we do at our facility. So first of all, let me start by saying we are a group of like-minded healthcare providers whose philosophy is we want to treat our patient with the least amount of pharmaceuticals necessary to ensure that they don't have the side effects from the pharmaceuticals on top of their medical challenge side effects. In other words, what we want to do is we have a philosophy that we can do anything any other primary care facility can do because we're working out of our primary care facilities license in Marlton. So if you need an x-ray, if you need blood work, if you need specialized testing of any kind, we're going to get it done for you. But again, our philosophy is what's different than most primary care facilities in that we want to use the least amount of the pharmaceutical in order to effectuate the change, keeping you safe, obviously, if you have a challenge, and helping you resolve that challenge with a combination of natural products as well as the pharmaceuticals. And in some cases, we're able to help you get off your pharmaceuticals or certainly cut them down. And that's really what separates us from everybody else. Now, the question you always ask me is, how do you deliver those? Well, we deliver those with hydration. And hydration is the mechanism by which we deliver, and it involves an IV therapy. And I will tell you, John, it's the most effective way to deliver some of the pharmaceuticals the nutraceuticals I'm going to talk about a little later. And by the way, my mind's on the pharmaceuticals too, because hydration has been a pharmacology delivery system since the beginning of time.
Yes.
Okay.
Yes, it has. One thing I want to say, you said what separates you, and you're talking about that. But what else separates you is that you take the time to talk to the patient, and you take the time to study the blood work and et cetera.
We try, yes.
Whereas, and I remember when my mother was living.
God bless her.
She went into the doctor, and he said, "Hi, Mrs. DeMasi, but how are you? Good. You look good. Okay, let me see." And he's gone.
That's right.
I mean, it was maybe a minute, maybe 2 minutes.
Right.
But
right.
But in the case of your facility, that you take the time.
Right.
And in fact, a couple weeks ago, you said to me, "I don't like the way you look." And it was, you did some blood work, and we come to find out that I'm anemic.
Right,
partially,
yeah, a little anemic. Yeah.
And so you gave me a
iron
pill,
supplement.
iron supplement, and I'm fine. So
and
it just goes to show you take the time.
Well, I think one of the things I like to give credit also to our nursing staff and my clinical staff, because they're trained. Nurses are trained to observe. Okay, and God bless all the new nurses that just got out this month. They are trained to observe, and it's very important, the observation of patient. Problem is, they don't usually have time to observe because they're so busy in the way the current system is. We are lucky in that when a patient comes in, you're going to sit in our chair for a while, right? And you have dialogue from the moment we go into our phlebotomy area, right, to have your IV started. You're talking one-on-one, either with the lovely Linda, with Sandra. You're talking with one of the nurses, whether it's Jess or Lana or someone. You're talking to people at our facility who have the ability to observe and say, you know what, Molly, our patient out there today just doesn't look quite right. So I think maybe we ought to tell the doc to order something else and whatever. And that's exactly what happens. And I go out every chair change. I'm out to see somebody out there.
You're out there quite often. Yes.
Right.
Yeah, that's true.
In fact, I'm going to get a pedometer, right, to start watching those steps, because one of my friends who's an orthopedic surgeon said to me, how many steps do you do a day? Because, you really have to do, 10,000. I said, honey, I beat that for sure.
Yes. Well, to your point, the apple doesn't fall far from the tree because your nurses follow your lead.
Yes, they do.
So that's really where that comes from.
They're
but
great people.
Tell me, if people come to your facility and they go through with the treatment, what can their expectations be as far as how many weeks and how long will they go?
Loaded questions, John. You know that.
Till they feel better.
Sure. Here's the deal. Most people come in, and this is what separates us from a medical spa. You're not going to come in here and tell us, oh, you want Botox, or oh, you want this. Bottom line is, most people come into us when they have a challenge. It's very rarely do I get somebody who comes in and says, I'm perfectly healthy, I feel great, I just want a couple IVs to feel a little better. Okay, it doesn't work like that in my facility. Not that I wouldn't love them to do this, right? Because it certainly would be easier. Most of our patients come to us with some type of challenges, right? So, therefore, it depends on where they are in their continuum of care. Like, if you have cancer, obviously, you're not going to start to feel good on one treatment. Now, you may find a little bit better, but you're not going to really address some of the underlying problems that cancer supportive care can help you with. The other thing is, if you come in with an autoimmune disease, of course it's going to take a little time for us to even do the archaeology through the charts and say, okay, this is really what they have. Lately, I've been doing a lot of autoimmune with a multitude of conditions that actually work on the autonomic nervous system. And people know, don't ask me about POTS, P-O-T-T-S. People are always calling me. They've been diagnosed with this. I have several patients who have POTS, and that involves their nervous system, and that's a very difficult thing. So people in that case are not going to feel good till at least 6-7 weeks, getting treatment once or twice a week. But there are other conditions that people start to feel really good in 2 weeks, in 3 weeks, John.
Yeah, I heard a patient the other day say, gee, I feel better already. And it was like 2 treatments.
There you go. Right. It depends on your condition and when you come in and what is the underlying situation. Then I have people who are really just depleted, absolutely depleted nutritionally, and they believe they've eaten a great diet, they're taking supplements, they're not absorbing anything. So they may be with me for 10 weeks. So it really depends, John.
We're going to talk later about some of the things regarding men.
Yeah.
But I wanted to ask you, what are some of the key ingredients that you use?
Of course, vitamin C.
Vitamin C, right.
Yeah,
but besides that?
B vitamins, certain extracts of Bs. Again, I love to use God's ingredients, so my extracts are extremely, extremely good. We are using natural extracts, and that makes a huge difference. rather than pharmaceutical grade extracts. And they're out there. I mean, you can go into a pharmacy and, get some vitamin C injectable that is manufactured, ascorbic acid. And believe me, I'm a scientist. I take the heat. Oh, there's no difference chemically. It's ascorbic acid. Well, I believe that the body has an innate ability to really distinguish between a food source vitamin C and rather than a manufactured. So that's some of the things we do.
And I know you've talked about turmeric. And
oh, my goodness. I'm
and...
going to talk a little more about some of these things because I think it's really important to understand that our extracts are extracted from natural plant source and or sourcing is extremely important, which is why I love my compounding pharmacists, because I think they really, now their hands have been getting tied thanks to the FDA and the regulations that have come in and all the pharmaceutical. By the way, folks, your vitamins, check out all the wonderful brands that were out there 5-6 years ago. They've all been bought up by large corporations, and you can be sure that regardless of what's being said, there's going to be changes in those recipes. There's going to be changes. And I've seen that already in some things. So, again, people come into us. It's going to depend on where they are in their continuum of care, what I need to put in their bag, where I get the extracts, and how we deliver.
What conditions work best for you as far as your facility? Another loaded question.
Well, it's a loaded question. I've seen people who have autoimmune who greatly improve. Whether that's arthritic conditions, we can help eliminate some of the pain. I've seen people come to us with severe autoimmune problems that are really impeding their quality of life, not just with pain, but with fatigue. So again, I love treating our cancer supportive care patients because they think out of the box. They know that if you go to the right kind of place, you can do conventional treatment and still manage to get through that in a fairly decent way. If people you go to for this type of therapy really understand what they cannot do for you while you're getting your chemo or the radiation.
And we should mention that you have over 600 protocols.
Yes, 600 variations of, right, that's exactly right.
Those are the recipes, sort of.
They're my recipes, right.
Right.
And I'm not inclined to give them out.
Well,
okay.
And you shouldn't. Coke doesn't give out their recipe.
No, I know that. I know that.
I told you that years ago.
You did.
You used that in a...
Yeah, I did. I used it for somebody. Yes, I will give you an overview of what you're getting. But, a lot of this, John, is in how you put together a particular protocol. What types of natural substances work with each other so that they can effectuate the change, and how do you deliver those? There lies the value. If you notice people generally get a multitude of bags when they're sitting with me.
Yes, I do.
Okay,
I do.
Yeah, and so there's a reason for that. It's because the synergies of certain things need to be delivered by themselves with some other things in other bags, and therein lies the rub.
That's
how
right.
you deliver.
We are coming up on our first break of the morning. The show is called Health Watch, and it is here every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Our number here in the studio, and we always tell you at this time of the show, call early so we can take some time and review your situation, rather than every week we get a call at 5 minutes to 9. We can't take you. 855-839-1210 is the number, 855-839-1210. It's Health Watch, and I'm your host, John DeMasi, with Dr. Molly Fantasia. We're both returning after these words. Welcome back to Health Watch, and as always, operators are standing by at Innovative Medical Associates, and they are there right now, and they're ready to talk to you. 856-489-0505. That's the number, 856-489-0505. And it's pretty simple. When you call, all you have to do really is set up the initial consultation with Dr. Molly, and you can find out a lot about what she does and how she can help you and her staff as well. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210. WPHT. Dr. Molly Fantasia is here and ready to talk to you. Our number in the studio, 855-839-1210. Last week we talked about the moms and women, and we got to give equal time. So we're going to talk about men. Right?
Yeah, that's right. ahead of Father's Day.
Right.
Because we're coming into June and we're going to have a good Father's Day. But I started thinking about this basically because I have a couple of patients who came to me with prostate issues. And, I think that, it is a difficult situation because prostate issues are complex. And it's seen in men after a certain age. PSA is still used as the prostate screening test in many practices. Okay. And, of course, myself being a scientist, I'm always looking at new development. And I knew that there were some things out there to utilize that might enhance the ability of the physician to make a diagnosis, whether it was BPH, which is the benign prostate enlargement, or potentially prostate cancer. And for the last 10 or 15, I can't even tell you how long, we use something called the free PSA along with a regular PSA. And it was an indicator or a marker to help the doctor decide whether the patient had a risk for prostate cancer.
So there's two tests that
there was two tests we were always using. But just lately, I started to look at something called the PH.D test, which is really an index test for early detection. It can help really utilize our ability to detect early detection of prostate cancer. Because, again, the PSA always had limitations, and the third generation PSA has some limitations too. So this was just a smarter way to utilize, and we've been doing this for our patients. And one of the reasons why, John, is it bothers me sometimes when a guy comes in and he says, oh, my doctor said, let's just do watchful waiting. We did a needle biopsy and I had some cancer cells in there, but not a lot. And therefore, let's watchful wait. Right? Because prostate cancer, for the most part, can be slow acting. That always bothered me because I started to think about it today. Prostate cancer today is approximately 40% lower by using the couple of tests that we used already. But when there's something new out, you really should be looking at it. Since 2023, the PHI is an index at an actual cancer assessment risk that's to help unnecessary biopsies, which potentially are, they're painful, they're risky. Wouldn't it be good to have another index utilizing the PSA, which has been around for many years, utilizing the free PSA, and then utilizing a calculation or an index of PSA score that can help us really look at, is this a better way to assess the prostate health? Well, indeed it is. Looking at all the key elements in this assessment, it really is. It has greater accuracy, greater specific type of data that can come out. The specific biomarkers provide more accurate and specific and reliable indication of prostate health compared to the traditional testing that's been around. So what does that do? It can help a guy have a situation where he has an unnecessary biopsy. I'm not saying that biopsies are the gold standard. Of course they are. But, I have some guys who say they don't want that. They don't want it. Right? Period.
I don't blame them.
Yeah, right. Okay, I hear that, right? So something like the PHI can help reduce the number of biopsies by 30 or 40%. It can aid in early detection. It can improve patient outcome, and it can improve the patient's trust in their physician. So it's something we're going to be doing routinely on our patients who come into us, and there's a possibility of prostate cancer. Again, you want to use the gold standard. You do want to encourage men to go to their urologist, which we do. And we can certainly have discussions around what does this thing really show and how can we actually push advances in prostate diagnosis so that a patient then has an option to do while they're watchful waiting. Coming into a clinic, a medical hydration clinic like ours, gives a patient an opportunity to utilize some natural substances that can help him through his prostate journey.
Does it mean when a gentleman comes into you and says, I have an enlarged prostate?
Right.
Does that mean he's susceptible to cancer, or does it just mean he's
it means he's got some trouble. But the problem is what is really happening is an elevated PSA absolutely indication of prostate cancer. The answer to that is no. But it can be this benign problem. Now, who should be getting all these tests? Well, listen, if you have blood in your urine, right? If your prostate is enlarged and you're having trouble urinating, or you don't feel the frequency or you're having more frequency but you can't empty totally, then you should be looked at by the urologist, and certainly you should come into our facility and get some of these testing done. And if you're our patient, we definitely are going to do it. We're going to routinely run this on a lot of our male patients. It's something I'm really interested in if they have these types of problems that I just mentioned. So again, you want to take all the data. You want to look at all the data, not just some of it, and say, oh, let's get you in for a biopsy. But again, you also don't want to be cavalier in doing it. You want to be armed with data. So there's been advances in prostate cancer, right? In the early days, they used to just take out the whole prostate and that was it, right? You know, and it's not an easy thing to manage. So what I would say is anything that can be introduced as a screening tool for prostate cancer, it can help reduce the incidence of prostate cancer, we should look at.
Is it your philosophy, and do you think there's something wrong with the fact that doctors are saying watchful waiting?
Well, it's not right.
It's not right or wrong, but
it frosts me a little bit, because does that mean does the guy come back? Sometimes I hear watchful waiting come back in a year. Well, I don't know.
A lot can happen in a year.
You bet. And so even if if anyone I loved, any man in my life got a diagnosis of some quote unquote cells floating around in his prostate, and it's going to be watchful waiting, I'm going to put him in my chair for sure and utilize a cancer supportive program for them. That's the whole point of things like this, so that we can help in this watchful waiting process to maybe reduce the patient's risk of having a more severe outcome.
We are coming up on the halfway point of the show, and that means you still have plenty of time to call in. If you have a medical challenge you want to run by Dr. Molly, or you have a question, 855-839-1210. That's our number here in the studio, 855-839-1210. Program is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, 855-839-1210 is the number. We are coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch. Operators standing by at Innovative Medical Associates, and the number 856-489-0505. Again, 856-489-0505. When you call, you want to set up that initial consultation with Dr. Molly. It is complimentary, and it's an exploratory session, and you'll find out a lot about what Dr. Molly does and how she can help you potentially with your problem. 856-489-0505, that's the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com, that's the website. Back here on Health Watch, 855-839-1210, that's the number in the studio, 855-839-1210. We happen to have some open lines right now, so if you want to call in, this is a good time. We were talking about men and prostate cancer.
Prostate health.
Prostate health. What are some of the things you recommend?
So here's the thing. Everybody sees all the commercials and they're thinking, what can you do for your enlarged prostate, right? You know, saw palmetto, beta-sterol prostate formulas. There's a million of them out there. How about if your enlarged prostate is a little more serious than that, and it is something like cancer, or could it be an infection? Have you ever heard of having an infection, urinary tract infection?
Yes,
right.
Yes.
So if a patient comes in and we see that ultimately they went to the urologist and finally they found out after 3 or 4 visits that he actually had an infection. In that case, we might want to use some of our antivirals that we use, lysine, melaleurin, if it's a viral infection. And you can get a viral infection down there, guys. The other thing is we might want to use things like riboflavin, okay? Riboflavin is something that we've seen has really helped. It's a form of B2 rather, and it's coexisted in an inactive form in riboflavin. How about we use, for some of these benign problems, we've used anti-inflammatories. The big one is what? Vitamin C. We've used vitamin C in various forms. In a form like that, I might use the extract of tapioca in a form like this, because again, it might do well for the cancer patient as well as even for the benign prostate problem. I might want to use grapeseed extract, right? Or in some cases, resveratrol. That's something because of the anti-inflammatory properties of this that will help. It can help both the benign prostate and if there is a potential for this watchful waiting and they saw some cancer cells. There are extracts, believe it or not, John. You want to know one that really is very interesting? It's the extract of green tea. Green tea. And
I would never think that.
No, but it is. It helps. It helps. And it's also highly anti-inflammatory. So would we want to do that? Yes. How about looking at utilizing boswellic acid? You've heard me talk about that before. And we would use that. Why? Because it inhibits a certain type of anti-cancer transcription factor. So these things, we just don't pull this out of the air, John. There's scientific information in a lot of these extracts. In terms of the green tea, it actually uses something called galactic acid. And this belongs to a group of phenols, right? Phenols, which is in beta phenol, right? Whatever. So, I mean, this whole thing, there are many overlapping things we can use for a prostate cancer patient. I think for many, many years, people who were doing this were using this for things like breast cancer and ovarian cancer and lymphatics. But there are things we can do to help hold down this inflammation regarding the prostate as well.
I have heard, and you mentioned saw palmetto.
Oh, yes.
Way back in this. I have heard that men should take that in their 30s and they should continually take that. Is that true? Or
I think it can. Let me tell you, there's no harm in taking saw palmetto, but there are a lot of good prostate health formulas out there, and I'm not going to go through what brands are good or bad. If you're a patient of ours, we recommend. I don't have product in there that are private labeled. We use a particular group because I like the science behind the particular products. But yeah, there are a lot of good products out there. My goodness, I can't tell you how many we've seen in terms of guys who come in. And by the way, guys can get 3, 4, 5. They'll spend a lot of money on this, to help, of course, with that feeling that they have of not being fully empty, right, when they're urinating. And I have to laugh sometimes because I say, listen, guys, there's a good product out there. Let me tell you, while you're in the chair, I'll give you some of the information on it. But saw palmetto is fine, and a lot of the male products have that in there. The other thing I would want guys to look at, again, going back to the blood work, John, we don't just stop at looking at the prostate blood work. I might want to run hormonal blood work for guys. I want to see how are they doing with their testosterone. If their testosterone is too low, or they have a problem and they're actually converting their testosterone to estrogens, that can also be impeding some of the ability of what's going on with their prostate. So it's complex. But again, going back to our particular protocols, the anti-inflammatories are extremely important. You want to look at this. Turmeric is another one. Definitely.
I've heard you mention that many times.
Many times. Turmeric, curcumin. So there are many things. Now, interestingly enough, we've seen people use something, an extract of wormwood, has been used in Chinese medicine for so long, right? And it also has an effect on all cancer cells. So again, but you have to use the right stuff, because there is wormwood, by the way, in Italy, they've made this into a little drink. That's a little effervescent, and it's like a 4-ounce drink. But you want to use the right stuff, because there can be poisonous wormwood. It's not always good. So again, I say you have to talk to somebody who really understands natural products and what they're used for. But there's a lot of overlap in the products for prostate health that have to do with anti-inflammatories.
You said earlier that there's a 45% decrease in the mortality rate in prostate cancer.
Yes. There's
so what do you attribute that?
I attribute that to the fact that they were using and are using more sophisticated testing, including the third generation PSA along with the PSA. And I think now hopefully more and more urologists are looking at the PHI that I was speaking about. But I have to say that in our clinic, I haven't seen that. I think there may be an age bias about it. I think they're not doing it, let's say, in men over 70, because they just think if you've lived that long, you don't need it. You know what I mean?
Yeah.
But see, I have a bias the other way.
Yeah.
I want us to live as long as we can.
Right.
The good Lord said in the Bible, 120, I think.
Yes.
So my belief is there's a lot of that left. But I think it really has to do with the accuracy of the new testing out there that has helped men. But again, I do think that sometimes the move to biopsy can also cause a lot of problems.
So it really depends.
You really got to have good providers, and that's it. And also then get some information from other physicians. I will say I have 2 women physicians in our clinic, but I'm going to tell you they're pretty hipped up on utilizing what's out there for male health, and they really have an interest in making sure. And you will notice on every test that we've done on any of our guys who come in, we've always run the third generation PSA that wasn't being run for many, many years. We were a little ahead of our time doing that. They're very key on grabbing the data to make sure that we're doing everything we can to help lower this rate. And also the survival rate. Early detection helps the survival rate for us to go well into your 80s.
What would you recommend if someone is listening to this and they say, well, maybe I have a problem? What would you recommend they do? Should they?
I think they ought to talk to their doc, and I think they ought to talk to their urologist. And I think you shouldn't just sit around and not do anything. And if it comes back that you just have benign prostate enlargement, I think you should still be in my chair. And I think we should deliver anti-inflammatories and help you with this issue. It's as simple as that. And I think you've got to stay, just the way I tell the breast cancer patients. I'm not going to tell you don't do traditional treatment. I'm going to tell you do traditional treatment, but come on in and see us. We can help you through this.
Preventative is really the key.
Yes. And John, I really mean that, because I think guys and ladies out there, your men, I think you should be pushing them to make sure they are assessing their prostate health. I think that's the issue.
We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge that you want to run by Dr. Molly. 855-839-1210. That's our number here in the studio, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I am your host, John DeMasi. We are both, Dr. Molly and I, are returning with more today's Health Watch after these words. We are back here on Health Watch, and again, operators are standing by right now at Innovative Medical Associates. And I will tell you, they'll be there. If you call now, fine. But if you want to wait till after 9 when we're off the air, they're going to be there all day. So, Dr. Molly works them, okay? 856-489-0505. 856-489-0505. That's the number for Innovative Medical Associates. You call there and you schedule your initial consultation with Dr. Molly, and you'll find out a lot about how potentially she can help you and any member of your family as well. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you missed any of today's show or you just liked it so much you want to hear it again, well, this afternoon we have our Health Watch replay, 4 till 5 this afternoon here on Talk Radio 1210 WPHT. Our number here in the studio with the time that we have left here on the show, 855-839-1210. We still have some time to take your calls, 855-839-1210. We're going to talk about some patients. And
sure.
Dr. Molly, boy, this is a tough one. Your patient with COPD?
Right. Now, this is interesting, folks, because I've been talking about her because she had both a candida that was unique as well as a bacterial infection in her lung. So in looking at her history, though, I knew there was a reason. I kept saying, why does this patient getting these things? Well, here it turns out that she worked in a woodworking shop and she was doing varnishing without a mask.
Oh, boy.
Okay. So, of course, she already had the COPD. And, of course, we knew this while I was treating her for these two other things. Now, we have pretty much eradicated everything but a small amount of the bacteria. And now what we're doing with the good help of the good doctors and myself is we are going after her COPD as well as what's left over that's causing her to cough so much. But I got to tell you, John, that COPD is such a difficult thing because, secondhand smoke has contributed to things like this. Can you imagine being in a woodworking shop and not using your mask? So think about how much worse she gets this infection, but her underlying condition, she already has COPD. You can imagine how difficult this has been for us to do. We're on the 8th week that she's with me. Remember, she's coming in from Indiana. So we're on the 8th week of this. And I'll tell you, we've got tremendous improvement, but it's still the coughing is there and the COPD is the underlying issue at this point.
That is tough anyway.
It's tough anyway,
right? Yeah,
right. And you've got to be on the right inhalers. I mean, I'm talking about traditional meds. And then you've got to be using the anti-inflammatories along with this, not just the traditional things like in terms of the bacterial infection, the antibacterial, as well as these things for the candida. But this is a very difficult case, and we're working as hard as we can.
So, this is a long hauler.
Oh, man, unbelievable. And, you think and believe me, we have long haulers who have lung problems based on the fact that they had COVID-19. The one good thing about this woman is she didn't have the COVID virus because I don't think she'd even be here if she had gotten that as well.
Really?
You know what I mean? I think she wouldn't have been here, really.
Wow.
It's a terrible, terrible condition.
A couple of other patients you have, one from Indiana, and you want to talk about that?
Oh, yeah, the depression. We have two patients who come in with severe depression. Severe depression. Now, we have an antidepressant protocol for medical hydration. Now, I am not telling you to get off your antidepressants. In fact, I'm going to tell you stay on your antidepressants. It's very, very important. You do not just drag a person in, give them what we're giving them in terms of the B vitamins. By the way, you need to look at their genetics to make sure you're giving them the right form of B vitamin to aid the antidepressants that they're on, as well as using NAD, which you all know about. You've heard me speak about NAD before. And I can tell you that works on the mitochondria of the brain cells, and that's an important addition to the antidepressive protocol. Also, we use nasally. We use this nasally. In other words, it's a nasal spray a couple of times a week for this patient, utilizing a subclinical dose of a particular drug that is completely not related to depression and helps really recenter some of the mitochondria.
The depression medicines a lot of times are pretty rough to handle.
Yes, they are.
Do you try to wean
we
people
mitigate.
off?
What we try to do is mitigate some of their side effects. Like, we want to help increase your energy. But at the same time, you do not you don't stop an antidepressant. You have to do it carefully. I'm lucky to have Dr. Pat, who is an anesthesiologist who understands the mechanisms of what's going on in the brain. And we do not cavalierly take anyone off their antidepressant. Can we wean them down? Many times we can, with the use of the natural substances, and again with the subclinical use of another type of medication. But we do not. You also, listen, John, you also need some therapy. When you're depressed, you need to get to some of the underlying causes that have caused this, you know? And I'm a big believer in utilizing your psychiatrist. There are a lot of integrative psychiatrists out there who actually refer people to me because they know that patients can be helped with the right nutrition as well as the therapeutic process and as well as the pharmacology.
We have time to talk about one more patient.
Okay.
You want to talk about Joe?
Oh, yeah, Joe. Yes, okay. Joe's a very interesting patient as well. Another patient with severe depression who's been everywhere. He's been to integrative psychiatrists. He's been all kinds of places. We are actually doing the form of the NAD. We did the genetic testing showing that he had a genetic dysregulation to help him process his B vitamins. So once we got to the right sort of Bs for him, along with everything else that the psychiatrist wanted to do, and the addition of the subclinical dosing, we were able to bring up his mood. This week he was smiling, something we haven't seen in like 6 weeks.
How about
and
that?
I got to tell you, a lot has to do with how you process your B vitamins, folks. If you have a dysregulation on the B vitamins, you're not going to be able to get the enhancement that they do for our brain. No question about it, John.
Well, believe it or not, time's up on our show. That's going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates, 856-489-0505, 856-489-0505. They will be there well after we leave you at 9 o'clock. In fact, they'll be there all day. So give them a call, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, we have our Health Watch replay this afternoon, 4 to 5, here on Talk Radio 1210 WPH.D. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, Donna, Jess, Vicky, and Daniel, and then there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. Have yourself a great week. We'll do it all over again next Sunday, Health Watch, 8 till 9 here on Talk Radio 1210 WPH.D. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.